Good morning and welcome to Coffee with Dan. Today we have Dr. Keerthi Gunasekara, a consultant respiratory physician, Central Chest Clinic Colombo and the National Hospital of Sri Lanka. And we are going to discuss an area that was not discussed before in this program, and it's about asthma and wheezing. So good morning to you, Dr. Keerthi.
Good morning, Dan.
Let me ask you, first of all, what does it mean by the term asthma?
Yes, I think everyone refers to asthma as a very common disease. Everyone is aware of it. But also there is some kind of fear and a feeling of I don't want to be labeled an asthmatic. This is a common thing that a lot of people think of when you talk of asthma. But asthma is actually, we know that it is something to do with breathing. Yes, we know that all asthmatics have a difficulty in breathing. So it's a breathing problem. If you try to define asthma in layman's terms, it would be like it is a disorder which causes difficulty in breathing because of narrowing of the breathing tubes. As you know, a lot of people think that it's your lungs, but when you take the respiratory system or your breathing system, it actually has three main components. That is the breathing tubes, the lungs per se, and of course the covering of the lungs, what you call the pleural tissue. But asthma doesn't actually affect the lung per se, but it is the breathing tubes, which the conducting tubes which take the air from the environment to the lung, which are affected. Actually, what happens is that these tubes are very, very sensitive. And these tubes, and they are small as well, and they, when irritated, they go into spasm and they start swelling up, what we call inflammation in scientific terms. And this causes a tightening of the tubes, and therefore the airflow from the environment to the lung is restricted. And this restriction causes, obviously, it causes a noise when you breathe, because the air now has to go through a passage which is small and which we call wheezing. So asthma is virtually a disease of your airways, which actually intermittently, it's not a persistent thing, which occurs episodically and which causes narrowing of your breathing tubes, and it is linked to allergy.
How common is it?
Yes, asthma is one of the commonest respiratory disorders that we see, or the lung-related disorders that we see. Now, we have conducted a nationwide survey on asthma in children, which was done in almost 153 countries, called the ISAC. And we found that every 1 in 3 child wheezes. Every 1 in 3 children will say that they have wheezing. And Sri Lanka is recognized as one of the highest prevalent countries of asthma for childhood. It is almost coming from more than 20%, which comes into the high category, which falls into categories like New Zealand and Australia, which are countries which have very high prevalence of wheezing. And even when we take adults, we find that about 20% of them will complain of signs and symptoms suggestive of wheezing. And this is also true if you take the Sri Lankan statistics. We have roughly about 200,000 to 300,000 patients, asthmatics, who are admitted to state hospitals every year. And the alarming thing is that we have roughly about 1,000 deaths from asthma every year, right? So it is not a thing that we can ignore as well.
If I may ask you, is it due to an atmospheric condition, or is it a generic?
It is a very complex situation. In the sense, it is you have a part of heredity also playing a role, and then a part of allergy also playing a role in environment also. It's multifactorial, because earlier they thought that asthma was limited to the richer countries, and with affluence that asthma was getting worse. But this is always not true. But if you look at our rural areas, like now we have places like Inginiyagala, Monaragala, which have very high asthma rates. We have lots of children with asthma. So it is not linked with affluence directly. There are so many environmental triggers which cause asthma, but on a genetic predisposition. Why do I say that? Asthma is mainly linked to allergy. Now, what is allergy? Allergy is when a person reacts to a normal stimulus, like, for example, pollen, or you get house dust, or some fungus in the air, which is normally innocuous. It is harmless, and it doesn't do anything. But an allergic or an atopic person's body recognizes this as a harmful thing. So the moment it comes in contact with the lining of your breathing tubes, right from the nose right down to the lung, then what happens is, it is like touching a caterpillar. The effects of touching a caterpillar, it starts itching, and then it starts swelling, and that is what we call inflammation. So this is a trigger which is an abnormal immune response. It's not a normal immune response. So what triggers this immune response to be abnormal is your genetic or your hereditary composition. Right? So you have a hereditary tendency to be allergic, to recognize normal things as abnormal, and then your body reacts very violently trying to kill this thing which is actually not harmful to your body. In the process, what happens is all your tissues get swollen and edematous, and when these tiny tubes get swollen, there is no space for the air to go, and then it's like sort of a feeling of strangulation, because you can't breathe, right? But this is not a continuous thing. After a couple of hours, it fades away. Then it comes back again. So when you are exposed to these different allergens, different proteins, then you react. So this is the process which goes on in asthma.
I understand that wheezing and asthma are quite connected. Does everyone who has wheezing have asthma?
No, not necessarily. Wheeze is one of the most important symptoms of asthma. Yes. The asthmatics, how do you recognize an asthmatic? Actually, firstly, when you get this irritation, you might have a dry cough. Actually, this dry cough is usually early morning or at night. Or you can have a wheeze. Why? With these breathing tubes getting tight, you can hear a wheeze sound in your chest. So this is very often seen with asthmatic. Or you can feel a sense of chest tightness, and you feel that it's difficult to breathe, and you're short of breath. When you climb a flight of stairs, you find that you're short of breath. Or when you dust your house or mop your house, or if you go out in the rain, or if you are exposed to some dust, then you start coughing and feeling a bit heavy in the chest. Sometimes it manifests as a cold which goes into your chest and lingers on for some time, and it doesn't leave you, because this is what we call a bronchitis, because the airways are called bronchi, and swelling of the airways is called a bronchitis. So asthma is also a kind of a allergic bronchitis. So this asthma, wheeze is the main symptom. However, we must remember that wheeze can occur in other conditions as well. Very many other conditions can cause wheezing. For example, if you have a thing called bronchiectasis, where there is damage to your lung tissue, you will start wheezing. If you have tuberculosis, you might be wheezing. If you have heart failure, what we call cardiac asthma, actually when your heart doesn't pump well enough, then there is more fluid in the lung, then again you feel wheezy. So there are lots of many other conditions which mimic asthma by inducing a wheeze.
So in such scenario, how does a person know that he has asthma?
Yes, that's a good question because if you're asthmatic, usually you tend to have an allergic tendency, right? And there are some other allergic diseases which run along with asthma as well. Now, what are these? You can have a itchy nose or sneezing, recurrent sneezing. You find that every early morning you start sneezing at a rate. This is because nasal allergy. Now, this is linked with asthma. Or you might be having eczema, which is you have itchy skin rashes, particularly in your elbows or your knees. You might be having that. You might be having itchy eyes and itchy throat or irritation in the throat. So these are all symptoms. But these symptoms, the characteristic thing of this thing is that they are not persistent. They are intermittent. They come and go. But you sneeze in the morning, in the afternoon you're fine. Then again in the evening you sneeze, or seasonal. When some people are allergic to a lot of pollen, when the mango tree blooms or blossoms, then you start sneezing. You find that there are specific triggers, and this accompanied by a cough which comes and goes, or a wheeze which comes and goes, or a chest tightness, you find it difficult to breathe, it comes and goes. And also if there is a family member who has had such symptoms. And very often, if you take adults, you'll find that in the childhood that they have had some phlegmy condition. Right? They'll say, as a child, I did have phlegm. I had sneezing. I had to go to the doctor all the time. I used to be sneezing all the time, or I used to be having this chest colds all the time. Then you have to think that you have to have asthma. Now, do you have to treat this? Yes. Now, is it safe not to treat? What do we do? Now, this is another question. When do I have to go to a doctor? Now, this is subjective. Now, if you have symptoms, that if you're coughing or wheezing more than twice a week, that warrants treatment. Right? So if you're coughing or wheezing more than twice a week, that warrants treatment. Or the other thing is, even if you get an occasional thing, and if it is so bad that you can't breathe and you have to go to a doctor, you have to get yourself nebulized, you go into the hospitals and they give you this gas which you have to hold, and then you get relief. So that means that you are in trouble. You have a tendency to get into hot water. So you need treatment. And treatment for allergies is not easy, because it is not like an infection, because there is no germ that you kill and put it off. This is in your body. Is it not treatable? No, that's wrong, right? Asthma is treatable. It is controllable, right? Particularly what we do is we control the allergy, right? We control the reaction. We don't allow your body to react when these triggers come. We control it, but it is in the long term. This is why treatment for asthma goes on for a long time. Very gradually, we will be trying to get your system stronger so that we take you away from the allergy. Perhaps it's 6 months, 8 months. Gradually, with proper control, you'll find that you will gain control. You will know when your asthma is under control, and then you might be able to stop it.
Today in Coffee with Dan, we have Dr. Keerthi Gunasekara, who is a consultant respiratory physician and at Central Chest Clinic, Colombo, and National Hospital of Sri Lanka. And we are discussing about the health condition of asthma. Now we will go for a break, and when we come back, let us talk more on this topic. Let me ask you a very kind of a general or common question. Why do people get asthma? Is it only due to the conditions that you spoke, or are there any other circumstances?
Well, currently there are very many other conditions which are associated with asthma, apart from the allergies and things that I spoke to you about. For example, obesity, right? Obesity is linked with wheezing now, and it is recognized. Then there are some other diseases which, heavy smokers have this wheezing and cough, but it is a disease which is like asthma, which is not asthma, which we call COPD, chronic obstructive airways disease. why it's a complicated name. But basically, when we talk of lung diseases again, when you take the physics of it, we call some of these diseases obstructive or tightening diseases, which are pertaining to the breathing tubes. When the breathing tubes get tight, you call them obstructive, obviously, because of there is some obstruction to the breathing. And smoking can also cause damage to the breathing tubes and cause symptoms like asthma. But it goes on to further, as I told you, in asthma, the lung tissue is fairly well protected and nothing happens to the lung tissue. But smoking damages lung tissue as well. It thins the lung tissue and it causes holes in the lung tissue and causes this thing called emphysema, where the people get very, very breathless and a more sort of dangerous and damaging situation. So smoking is another thing which can mimic asthma but doesn't actually cause asthma. When you look at the triggers of asthma, worldwide it is recognized that house dust is the most common trigger of asthma. What in the dust causes asthma? When you go into the details of that, you'll find that there is a bug called the house dust mite, which is actually a microscopic creature. It's a mite which lives with wherever the human being is. The fellow is alive. The fellow survives on the skin that we shed from our bodies, right? Though we don't see every day, we shed a lot of cells from our skin, because the skin keeps on growing and the whole skin, it gets shed off and it gets onto our bedding, and this mite survives eating the dried scales which falls off our skin. And it is the feces of this mite which are highly allergenic. And this has been found to be the most common cause of wheezing worldwide. So what we call house dust mite allergy. So this is what, and then people have implicated it with urbanization, because as you know, with urbanization, when we come from the villages into the cities, we start living in houses which are enclosed, and we live on beds and not on mats, and then we have these mattresses and the bedding and the pillows which harbor these house dust mite, and then we have the carpets and the cushioning and the curtains and the teddy bears and all that which harbor these house dust mite. So they find that with urbanization you do have a lot of house dust mite there. Apart from this, you find pollen. Now, pollen is actually not the beautiful flowers that you see. These are the airborne pollen, which are the small seed from the grasses and the big trees which are pollinated by wind. So these are microscopic stuff which float around, and when you breathe in, they get into your lungs and they trigger an allergic reaction. Now, it is funny that, some people, they say, Doc, I have asthma. I fear I'm going to the US or UK or Australia, and I fear it's cold and I'm going to get a bad wheezing attack. But funnily, a lot of our patients do extremely well when they go. It is primarily because it is the change in vegetation, right? Because they are not exposed to these kind of pollen which they've been exposed to, and the allergic reaction doesn't occur, and they're fine. And then the moment they land back here, they start wheezing again. So you see, pollen plays a big role here. Then the other thing is dander. That dander is the pet dander, the fur from animals, particularly cat fur. It's supposed to be allergenic. But now you might wonder, now if a child has a pet cat and the child loves the cat or the dog, and then do you have to dispose of the dog? No, but that is also a wrong concept, because they say even if you don't have a cat and there is your neighbor's cat walking on the wall, there is enough dander in your house to trigger a reaction if you're allergic. So, I think what should you tell the parents? Well, don't take the pet into the bedroom, right? Try to wet mop the pet, and try to reduce the number of allergens which occur on their body, so that the child doesn't react. Then, of course, you can also do some allergen tests to see whether the child is actually reacting to this. And the mother will say, particularly, when the child has this, when the child plays, or when the cat comes into the room, she starts wheezing. You can identify. Now, there are some people who are allergic to horses, and they say, I just can't go near a horse, I start wheezing. So there are specific instances like that. Then again, cockroaches in urban dwelling situations, cockroach allergens. They find that if you have a lot of cockroaches in your living area, which particularly in urban dwellings with little ventilation, then you are subject to wheezing. And mold. You get the mold, which in damp conditions you find mold in your bathrooms, in your kitchen areas, or in your workplace. Mold also tend to sporulate. They tend to send out these very light spores into the air, which are microscopic, and again people get allergic to this and they have a violent reaction. These are some of the common things. The other thing that a lot of people implicate food with wheezing, but actually scientifically there is not much basis on this, that food can induce wheezing. And a lot of people keep off so many things, saying that you have to keep off tomato, you have to keep off prawn, you can't eat pineapple, you can't eat salmon, all kinds of things, saying no, it is not harmful. Now, what should we advise these people about? Well, allergies differ from individual to individual. It is indeed a very, very highly specific thing. And therefore, if you find that you react badly to a particular kind of food, then avoid it. But that also not lifelong. Very often these allergies are very, they're self-limiting. You see, 3 months, 6 months, you can challenge again and see whether it reacts. Just because another person can't eat tomato, that doesn't mean that every asthmatic can't eat tomato. That is wrong. Just because another person can't eat pineapple, it doesn't say that everyone else gets pineapple. So it is not. It doesn't hold true. So you have to recognize what precipitates it and then avoid it. However, there are some general things which all asthmatics should avoid. For example, a cool air. Now, why a cool air? Because you see, the asthmatic airway, I was talking of these breathing tubes. If you look at the inside of your lip, you can find that, or inside of your nose, you find that the lining is very, very sensitive, right? And it's a very sensitive and very delicate tissue that you find lying. Now, this is the kind of lining which lines your breathing tubes, which lines your nose, which is extremely sensitive to irritants. So now, in an asthmatic who has been challenged with all these allergens, if you look into the airway, it is very red and angry, right? It is red and angry. Why? Because it has been irritated. So now an irritated airway will go into spasm the moment it is irritated more. So what can irritate it more? Non-specific irritants like smoke of any kind. Right, so it might be cigarette smoke, it might be smoke from incense sticks, it might be smoke from cooking. So it can be whatever which smoke will irritate that sensitive airway which is already red and angry, and that will go into spasm, and these people will get difficulty in breathing. The other thing is chilling of the air. You see, so if you are under an AC or if you are under a fan, when you are having uncontrolled asthma, then obviously you're going to get a chill and your airway is going to go into spasm. Then again, apart from that, if you take chilled food like ice water or an ice cream or something chilled, and then, or ice beer or something like that, then you find again it cools your airway, which is already irritant. Now this, mind you, this I'm talking of an untreated airway. We are talking of an untreated airway. Right, I'm not talking of a treated airway. Right, if a treated airway it will not react so violently. So it is wrong to say you're an asthmatic, you can't have an ice cream for life. No, that is wrong. Particularly in children, it is very, very important to ensure that they have a normal lifestyle, because childhood once lost will never be regained. So they should be allowed to play, they should be allowed to enjoy the food that they want, in at least in limited ways you should. But you should know how to avert it, what to do when they get an attack, what to do when before a child eats an ice cream, right, and how to control it.
Dr. Keerthi, we got a call from a listener asking a very interesting question. Why there are more patients on POIDs?
Yeah, this is something which is actually actually claimed more mainly in Sri Lanka, that there are more the asthmatics get worse on POIDs. Is this true? Actually, we have conducted an all-island study, but in our survey, this the exacerbation during the full moon days did not come as a positive. However, as clinicians, we do see patients coming more. I agree with that. Is it possible? How can we explain it? Yes. You see, there are so many things that have been implicated with natural phenomena, and we know that, just like the rising tide, we find that the inside, even in our bodies, there are certain changes in the fluids and the mechanics inside your body, and you find that there are certain changes which occur. Now they say even psychiatric illnesses, certain psychiatric illnesses get worse. Yes, there appear to be a change. And funnily enough, along with this, again, it is scientifically proven that lightning, if there is lightning, you get more wheezing, because you find that certain particles in the air are ionized and due to the lightning, and this has an effect on the allergic tendency of patients, and this they definitely causes an increasing wheezing. So these are recognized. Volcanic eruptions, so many natural phenomena have been linked with wheezing, but these are not major things, but these are definitely have been identified. It's a correct thing.
In treating asthma, we know that using inhalers have become a very basic thing. But my question is, how do you treat asthma?
Yes. Now, as I explained to you earlier, we have to look at what we have to treat. If you look at the breathing tubes, one thing is that once the allergen or the trigger goes and touches these sensitive airways, they get swollen. And the secondary phenomena is that each one of these breathing tubes is encircled by a muscle. This muscle goes into spasm, and that makes the tightening worse. So the traditional treatment of asthma was using muscle relaxants to loosen the muscle. Most of asthmatics and parents of asthmatic children would realize that they've been using things called salbutamol or Ventolin or terbutaline. These are all what we call bronchodilators or muscle relaxants of the airways. People use this in the long term, and even today we do use it. If you get a bad attack of asthma and if you go to hospital, you will be nebulized with salbutamol, primarily because to loosen the muscle which is tightening the breathing tube. But it was later that people realized that this tightening of the muscle is a secondary phenomenon. The primary phenomenon which occurs is the swelling of what we call the inflammation of the airway, and we have to stop that. And if you stop that, then the muscle will not actually go into spasm. The stopping of the swelling is not an easy thing. So to stop this, the main medication which was used is steroids. The moment I use the word steroids, everyone would be very, very scared. But actually it is the steroids which have been shown to stop the swelling of the airway. Right, it stopped the swelling, and that steroids, there are problems because there are side effects of steroids when you take it in the long term. And then of course the steroids don't act immediately. It takes time to act. So now to overcome this, so we have now classed or classified the asthmatic medication into two groups. One we call the preventer medication, the other we call a rescue medication. The rescue medications are the muscle relaxants, right? So if you have a problem, you use a muscle relaxant. It gives you immediate relief, but lo and behold, within 2 to 3 hours, you might get an attack again because your muscle is going to spasm again. So if you have a bad attack, you go and get yourself nebulized with salbutamol, you go home, and in 4 or 5 hours, you might get another bad attack and come back again for a nebulization. Why? Because the underlying swelling or the inflammation is not corrected. So what did the scientists do? They started looking at methods of using steroids in a safer way, and that's how we have come up with the concept of inhalers. Now the inhaled steroids, inhalers, of course, you have both this kind of medicines. You have the inhaled muscle relaxants, or what you call the inhaled bronchodilators, or we have the inhaled steroids. Now the inhaled steroids have been made in such a way that the amount of medication that you get in that is very, 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 very minimal. Though it looks big, it is actually, we talk of the medication in micrograms, that is in 1,000th of a milligram. Now, if you get a steroid tablet, the minimum you can get is a 5 milligram tablet. But when you talk of a inhaler, we are talking of something like 40 micrograms, right? So that is, you're talking of 1,000th of a milligram. Right? And that is also made in such a way that when it is inhaled, it applies locally and it doesn't get absorbed into the bloodstream. So the problem with the oral steroid or taking a tablet orally is that it gets absorbed into the bloodstream, then it's dispersed right throughout your body. Your brain, your eyes, your kidney, your liver, everything, it goes everywhere. Right? So people still don't fear to take tablets because they're used to taking tablets, but they fear to take an inhaler because it's foreign to them, and they are scared about the implications of that. And because of the ignorance, they prefer to take the tablet, which is 1,000-fold more in dose. So, having said that, for therapy, for the long term, we recommend the use of inhaled steroid if you are getting your attacks regularly, right? We recommend to take your inhaled steroid. The newer versions have a combination of an inhaled steroid with a muscle relaxant, so which gives you an immediate relief and a long-term relief as well. Now these inhalers have to be used in the long term. You can't take it for 2 days, 3 days and say it's fine. You have to take it for months and gradually taper it off, very gradually, so that your body doesn't feel it. So many people, when they're alright, they stop it. Then again they get a bad attack. Is there a danger in having uncontrolled asthma? Yes, there's a danger, because as I pointed out to you, we have about 1,000 deaths in the state hospitals per se. Why do these people die? Because all of a sudden their muscles go into such severe spasm, right, that they just can't breathe. There is no airway left for them to breathe, and it's either in the middle of the night and you can't get to a hospital, or most of the villages are up on a hill, or they're surrounded by elephants and they can't get to a hospital. And at that point in time, because of the delay in seeking medication, they die. They succumb to the illness. So these are preventable deaths, right? So asthma is preventable. There are many professionals who are asthmatics. There are so many gold medalists in the Olympics who are asthmatics. So you must know to control your asthma but lead a normal life. Right? Don't fear your medicines. Now, steroids, again, people fear steroids. But remember, the steroids, I feel, is something akin to a knife in a kitchen. You see, you look at the knife and say, my God, this knife can kill you. Somebody can kill you. But at the same time, can you work in a kitchen without a knife? You can't. It's like that. A steroid is like that. A steroid, even when you get bad, right, the asthmatic should know what to take. They should keep some steroid tablets with them to take in an emergency. Because if you get bad, and if you know that you're prone to very bad asthma attacks, and if you are in a situation where you can't reach a doctor, you can't get help, right, you should have access to your medication.
Now, talking about the attacks and also the complicated situations in asthma, is this what you refer to as cardiac asthma?
No, the cardiac asthma is a different kettle of fish completely. Cardiac asthma is wheezing secondary to heart disease, right? Because these are patients who are usually with heart failure, or usually have leaks in their hearts due to faulty valves or hole in their heart, where they have big hearts, and there is a back pressure on the lung, and the lung gets congested. And then you have something akin to asthma, you start wheezing. But these people usually get very breathless at night. They'll be sitting up in breath, gasping for breath, and they'll have symptoms of heart disease. So this cardiac asthma is a different thing. But asthma per se, if you don't control it, it can give rise to a lot of damage. Because earlier it was thought that asthma was a harmless disease. Why? Because very often it is episodic. Right? It comes and goes, and it comes during rainy season, it comes during dusty seasons and all that. But people found out that if you take biopsies of even the mild asthmatics and look at it, you find that these are highly infiltrated with a lot of inflammatory cells. So there is a lot of damage going on, and if you don't stop this inflammation, right, what we call, you look at it from the outside like swelling, but it's not only swelling. Beneath you get more blood cells coming in, lots of more white cells coming in, and then the airway gets transformed, and the flexibility of the airway is lost, and they become stiff. And then people become, if you can remember those days, when you talk of asthma, you think of a person who is in bed, who can't get out of bed, who is struggling for and gasping for breath. This is why lots of people still deny a diagnosis of asthma. Right? Even if they have asthma, people don't like them to call themselves asthmatic, because still in their minds you have this terrible picture of people gasping for breath. And that is why people don't like this word. But this is because if you don't treat that inflammation, if you don't treat that swelling, then ultimately you end up with a damaged airway, which can actually cause you to gasp for breath.
Finally, let me ask you now, apart from the types of treatments that you mentioned, what should a patient do if he gets a bad attack of asthma?
Yes, one thing that brings us to a very important section again. Each patient should know to recognize what medication he's taking. A lot of our patients are unaware of what the medications they take. They should know what the relievers are and what the preventers are. Every asthmatic should ask his or her doctor, "Doctor, what should I do if I get a bad attack of asthma?" Because this is something which invariably happens to every asthmatic.